For your health this afternoon, October is Breast Cancer Awareness Month, and recently doctors have changed their recommendations for women to start getting mammograms beginning at the age of 40. To tell us more about the importance of mammograms is Dr. Lori Kim. She's an oncologist at Kaiser Permanente in San Rafael. Thanks for being here, doctor.
Thank you for inviting me today to discuss this important topic.
Of course. So the original recommendation had been that women should start getting screened at age 50, and now they're saying age 40. Why did they make that change?
Well, research has shown that women under the age of 50, there has been an increased incidence in the development of breast cancer, 1% per year. Because of those research and data, now the American Task Force and American Cancer Society recommends screening at the age of 40 years old. And please note, this is for a normal risk average women. Women who have a family history or a past history or genetic history of breast cancer, they need to be screened earlier, and it's important for them to talk to their doctor, and they may need additional screening such as breast MRIs.
Something fun to do once you turn 40. It's like a rite of passage at this point. Do you go every year, every other year? Assuming you have a normal test result, how often do you have to keep going after that?
For normal risk, it would be every other year starting at 40 years old. However, like I said, if you have a risk factor or personal history, then you should talk to your doctor about getting screened annually. And the recommendation starting at age 40 up to age 75. But I want women to know that if you're over the age of 75 and you are going to be living for more than 10 years, ask your doctor to get your mammograms.
And is it still true that catching breast cancer at its earliest stages is still the best place to be, like you have your best chance of getting the treatment that you need?
That's right. That's why screening saves lives. That's why it's so important for women of normal average risk to start getting their mammograms at age 40 before a lump appears. If you can detect it earlier, it equates to an earlier stage and better survival rates.
And so what are the risk factors? Who is most at risk for getting breast cancer?
So there is women who have a genetic mutation, which is 5 to 10% of the population. They're at a higher risk of developing breast cancer. If you have a family history of breast cancer, so look into not only your mother's side, your father's side, because each contribute to the development of breast cancer if you have a hereditary mutation or a personal risk. But we also know there is modifiable risk factors. In the United States, obesity is on the rise, and even we know that that can cause breast cancer and alcohol use as well.
So are there some lifestyle changes that people can take to try to reduce their risk?
Yes, exercise, don't consume so much alcohol, all in moderation, and keep a clean, healthy diet. Avoid processed foods, processed meats, red meats. Plant-based diets, exercise is so very important to decrease the risk of development of breast cancer.
Well, I'm so glad you could come on and talk with us. Dr. Lori Kim, an oncologist at Kaiser Permanente in San Rafael. It's so important that we have this conversation. The older I get, the more friends and family members I have that are impacted by this, so I'm glad we can raise some awareness today.
Thank you for having me.